Assalamualaikum. Welcome back to chapter 4. Right, in this chapter we will learn how to write prescriptions, specifically inpatient and also outpatient prescription. Okay, again I would like to remind everyone about our MOOC learning outcome, basically just to give you an exposure so that you can understand the principles of good documentation, identify common errors, and also perform the documentation yourself. Right, specifically for this chapter, we want you to be able to describe how to write a prescription properly, and we want you to be aware of the harm of prescription error, and we want you to be able to write proficiently both inpatient and outpatient prescription. So what is a prescription? Prescription is essentially a communication tool. It is where you actually order certain pharmacological treatment to be delivered to the patient. Okay, so the essential information needed in that prescription is your patient's name, the medication name, dosage, route, frequency, and treatment duration. Okay, the why do we actually need prescription is that it is to ensure patient safety. As we learned before, it is possible to write the plan in a clinical entry. You do not need to write a prescription specifically because the nurse can understand what you have written in the clinical notes. But prescription is a separate form that you have to write because the pharmacist is in charge of double checking your prescription medication. Okay, this is to ensure the patient receive the correct and accurate medical treatment. Right, so in inpatient setting, doctor writes the prescription. The pharmacist, before they dispense the medication, they double check everything, make sure the medication is the plan to be given is appropriate to the diagnosis and the patient condition. Once the pharmacist dispense the medication, meaning that the pharmacist has approved it, the nurse will read your prescription again on the frequency and the route of the treatment. So why do we need to write proper prescription? This is to prevent medication error, which technically can be prevented. If you write it properly, it may not happen at all. Okay, so medication error includes prescription error. So if this is an error made by the person that is writing the prescription, meaning that the doctors. Okay, prescriptions errors account 70% of the medication errors. So because of this, the profession pharmacist was introduced to reduce this error and make medical treatment more safe to the patient. Okay, right, so prescription errors can happen because of wrong drug, wrong dose, wrong route, wrong frequency, inappropriate or erroneous prescribing, inadequate evaluation, okay, errors in dose selection, okay, which is 50% of the errors. Okay, so in Malaysia there has been multiple studies. This is one example where they want to find out the prescription errors, where are the mistakes. Yeah, so these are some of the issues that they are facing. The age of the patient is not written down. Yeah, this information is vital because they want to differentiate whether this is to pediatric patient or adult patient. The date of the prescription was not written. Okay, in some cases is completely not readable. Okay, so why does medical error or prescription happens? Because of human factors. As doctors, we work in a very stressful conditions. Yeah, especially when you are posted in medical ward, you have so many patients, you have so many work to be done. Okay, but what we want to avoid is the lack of skills and knowledge in regards to prescription. I remember when I was a houseman, when I was a medical student, this was not given. We were not given an exposure on this, so I only learned how to prescribe when I was a houseman. Okay, which is already too late because I'm expected to be able to prescribe medication to patients. I would like to share with you some guidelines from Singapore Medical Council, specifically on prescription. Okay, we also have in Malaysia the guidelines, but I think Singaporean guidelines is very well put. Yeah. So in the guidelines, it is stated that you should only prescribe to your own patient. If you have not seen the patient, you should not prescribe to the patient. Okay, it is also quite common for doctors to prescribe to unknown patient that they have communicated through phones. This is not appropriate. Okay, when you want to prescribe to patients, you need to prescribe on clear medical grounds, yeah, with evidence, your purpose of your treatment, the expected results, and this interaction and side effects must be explained to the patient. So writing a prescription is not just writing a prescription. You have to explain to the patient what are you giving to them, right? You also must elicit drug allergy history. This is straightforward, okay, but sometimes we take things lightly and we take it for granted, and when something bad happens, we regret our decision, right? Prescription must be legible and unambiguous, all right? So this is stating that you should not use abbreviation in prescription because we want to avoid misinterpretation, okay? But sometimes it is acceptable to write the commonly used abbreviation. For example, paracetamol is commonly written as PCM, yeah, but in exam situation, I do not recommend you to write abbreviation because you want to get the highest mark as possible. Right, so for some patients, they are chronic patients, okay, you prescribe them regularly. Maybe you want to prescribe them for 1 year, but they should be reviewed regularly. Okay, so in situation where you are prescribing dangerous drug, you must double check that this patient is actually required to have this medication. Some patients, they actually fake their symptoms in order to have an access to this dangerous drug. Yeah, dangerous drug which includes your midazolam, alprazolam, and such. Okay, so this is highly addictive, and you have to be wary about prescribing this patient, especially when you are prescribing them in a long term. Make sure you review them appropriately in between. As much as possible, give them small amount and then you keep on reviewing them. Okay, sometimes you can give them 1 or 2 days and then you review in the next few days. So let's learn how to write prescription. So to write a prescription, you need the prescriber information, which includes the doctor's name, designation, MMC number, place of practice, and signature. Without this complete information, your pharmacist will not dispense, yeah, because only doctors can prescribe medication. Then you need your patient's information, their names, their RN number, their bed or ward number, okay, and then your information on medication, right? It is advised for you to write generic name. Okay, make sure there is no abbreviation and you use capital letters to avoid misinterpretation. Okay, you must write your dosage in as such. Your administration route must be clear. Okay, you want to give subcutaneous, you want to give IM, you want to give IV or per orally or local application. Your administration frequency must be stated. Okay, the treatment duration must be stated as well. 5/7 refers to 5 days, 1/52 refers to 1 week, 1/12 refers to 1 month. Okay, the starting date, then the indication of the prescription. Okay, so this is example of an outpatient prescription, fairly straightforward. You fill in the patient name, the patient's IC number, their age, the date of the prescription, and their diagnosis, and then in this area you put the patient's diagnosis, right? Then you sign and you chop. Okay, fairly straightforward, but sometimes because you have never been trained, errors can still happen. Okay, so this is an example. This is a case where the doctor prescribed the medication Zinat, paracetamol, and Celebrex to this Ahmad bin Saleh, who had lower limb diabetic foot ulcer. Okay, so you can see for how many days. The first one she's prescribing for 1 week. The subsequent one we do not know for how many days. Yeah, right. The information provided is accurate. Per orally is usually put at behind. Okay, this is a brand name. We prefer to use generic name, which is cefuroxime. Okay, Celebrex is also a brand name. We prefer you to use celecoxib. okay, for how many days, okay, and your CHOP is not included here. Okay, all right. So sample number 2, everything is in order. There is a duration here for the first one. Okay, however, this is not accurate lah. 24 tabs, right? Why are you giving specifically for 24 tabs? Okay, you just give the pharmacist how many days, yeah, so they can actually dispense. Okay, right, don't forget your complete CHOP and signature, which is your sign, your name, your MMC number, your position, and your hospital. Okay, so this is a good sample. The patient name is written, the IC number is written. Okay, if the RN was not given to you, do not write any RN. Okay, if you put any RN, this is a wrong patient. Okay, the patient age, the date, the diagnosis, yeah, the medication, yeah, the dose, and the duration, yeah, the frequency. Okay, it is also acceptable for you to write like this, includes per orally, okay, or you use the Q hourly system, right, which is also correct. Okay, don't forget your signature and CHOP. Okay, so this is a sample of inpatient prescription. You write your patient's name, their IC number, their diagnosis, yeah, their details. This is where you put your prescription details, and then you write your tarikh mula. Tarikh tamat is should be only written when you off the medication, and then you sign and CHOP. Okay. We shall see some examples. So this is how you should write. Right, if for example, if you are writing some sublingual GTN, you should write as such: sublingual glyceryl trinitrate 1/1 means 1 tablet, given stat. Okay, tarikh mula, and then sign and CHOP. Tab aspirin stat 300 mg, right? Tarikh mula, sign and CHOP. Okay, so this is a sample by a student. The name was written, the IC was written, the details were written except for height and weight and allergy. If you have this information, you should write down. And then he included IV Unicin, and then there's a writing over here that should not be there. Okay, this is wrong because you are not supposed to use brand names. And then this record administrasi ubat is for nurses to fill in. When the nurse dispense the medication and give to the patient, and the patient has taken the medication, the nurse will sign it. Yeah, so this is an indication the medication has been served. Okay, sometimes what happens is that the patient had fever, for example, and then you see the patient's fever is not subsiding. You just need to counter check whether the medication has been served or not. Okay, it is not rare for this to happen. Okay, sometimes the nurses are too busy, they overlook things. Sample number 2, same issue. Alright, tarikh tamat is not supposed to be written. It is supposed to be written only when you decided to off the medication. Again, the student is writing IV Unicin. You should not use a brand name. 2 gram QID times 1 week. Okay, for inpatient prescription, the duration it should not be written because you review the medication every day. So if you off the medication for today, you just write tarikh tamat. You do not need to give estimate to the pharmacist on how many days, because pharmacists will review this on a daily basis. Okay, so just update your medication chart. Okay, as long as you do not off the medication, the pharmacist will keep on supplying them. Okay, alright, and your sign and chart has to be accurate. Alright, inpatient prescription, no need to write duration. Your signature has to include all this. Right, good sample. Okay, Unicin is IV ampicillin, sulbactam, 1.5 gram stat, and QID. Okay, of course you have to fill in the details. Alright, so students may not know that Unicin is IV ampicillin and sulbactam. So when you go to do ward work, please have a look the common antibiotics, what are the generic names. Okay, you don't have to memorize everything, but at least try to familiarize yourself. Okay, let's recap. So basically what we have learned so far is to describe the guiding principles on writing prescription. You are now aware of the harm of prescription error, and you now should be able to write inpatient and outpatient prescription. Again, don't forget to go through our reading materials and complete the quiz at the last chapter. Thank you, and if you have any questions, please feel free to contact me.